Imagine having a crystal ball for hospital stays. I mean, what if we could actually predict pretty accurately how long a patient needs to be in the hospital?
And maybe even why.
Exactly. Today, we're doing a deep dive into some fascinating new research that seems to do just that. It's a paper by Luce and colleagues using advanced AI.
And a huge data set from Canadian hospitals, right?
That's the one. They're predicting in-hospital length of stay, or LOS. So our mission today is to unpack how this works, what they found, and, why it really matters to you.
Yeah. Okay, so LOS, length of stay. It's obviously super important.
Right.
We know it's a big deal for hospital costs, efficiency, but it's more than that. It's a real indicator of healthcare quality.
And it can even show up disparities in care, things we might not otherwise see easily.
Absolutely. But predicting it accurately, that's always been, well, incredibly tough. So many factors
This
involved.
sounds simple how long you stay, but yeah, modeling that whole journey. So what's the AI approach here? How do they tackle that complexity?
Well, they used a method called survival analysis. It's a pretty robust statistical technique.
Okay, survival analysis, like in clinical trial.
Exactly like that.
Yeah.
It's designed to predict the time until a specific event happens.
Yeah.
So here, the event is being discharged home.
Ah, got it.
And what makes it really suitable for this hospital data is how it handles what they call censored instances.
Censored instances, what does that mean?
It just means the model can account for patients whose journey doesn't end neatly with a discharge home. Maybe they were transferred somewhere else.
Or sadly, maybe they passed away.
Precisely. So the model learns from all outcomes, not just the straightforward ones. It makes the predictions much more, well, grounded in reality.
Okay, that makes a lot of sense. So it's a smarter way to model. But you mentioned the AI. This wasn't just any model, right? They focused on interpretable machine learning.
Yeah, exactly. This is key. Instead of just getting a prediction out of a black box AI.
Where you just have to trust the number it spits out.
Right. This approach lets us understand why the prediction is what it is. They actually tested a few models and found this hybrid, the XGBoost Enhanced Cox model, worked best.
XGBoost. So that's the machine learning part, boosting a more traditional statistical method.
You got it. And it hit about 70% accuracy in predicting the relative order of patient discharges.
Okay, hold on. 70% accuracy in the order. What does that mean practically? Is it predicting the exact discharge date?
Good question. It's less about the exact date and more about reliably telling us who's likely to stay longer compared to others. So patient A is likely to be discharged before patient B, who's likely to stay much longer than patient C.
Ah, okay. That's still incredibly useful for planning, I imagine.
Hugely useful. But the really exciting part, for me anyway, is the interpretability piece. They use something called Shapley values.
Shapley values, I've heard of those. They explain AI predictions.
That's the idea. They basically show how much each factor, diagnosis, age, maybe something else, contributed to that specific patient's predicted LOS.
Wow. So a doctor could see, okay, the model predicts a long stay for this patient because of factor X and factor Y.
Exactly. It builds trust. It turns the AI into more of a partner, suggesting why someone might be at high risk.
The transparency is huge.
Yeah.
So what factors did this interpretable AI actually flag as most important for LOS? Was it just the obvious medical stuff?
Well, yes and no. As you'd expect, the main disease diagnosis was critical. Things like cerebral infarction or septicemia, definitely linked to longer stays.
Makes sense.
And pre-admission factors matter too, like how long someone was in the ER before being admitted, or if they'd been hospitalized recently, say within 30 days.
Okay, still sounds pretty clinical. Were there any surprises? Things that weren't strictly medical?
Yes, and this is where it gets really, really interesting. The analysis showed that socioeconomic factors from the patient's neighborhood were surprisingly influential.
From their neighborhood? Like what?
Things derived from census data, like dependency ratios or local labor participation rates. It suggests that things outside the hospital walls, maybe financial stress on the family, employment status, can significantly impact how long someone stays in the hospital.
Wow, that's quite something. So it's not just the disease, but also the patient's broader life circumstances potentially affecting their hospital stay.
It seems so. It really highlights potential disparities and brings those social determinants of health right into the hospital setting. It challenges the idea that it's only about the clinical picture.
Yeah, that definitely gives you pause. Okay, so bringing this all together, this isn't just academic research or cool tech. Why should our listeners, why should you really care about these predictions?
Well, think big picture. Accurate, interpretable LOS prediction could genuinely change things. For patient care, it means identifying high-risk individuals much earlier.
So you can intervene sooner, maybe provide different support.
Exactly. Personalize the care based on their specific risk factors.
Hmm.
And for hospitals, it's huge for managing resources, beds, staff, scheduling,
Hmm.
making everything run more efficiently.
Right. Better flow, less waiting.
And crucially, understanding these factors, especially the socioeconomic ones, gives us a chance to tackle healthcare equity issues head-on, to try and ensure everyone gets the right care at the right time, regardless of their background.
What a fascinating deep dive. It really shows the power of combining data, smart AI, and that vital layer of understanding the why. It feels like a step towards more personalized and hopefully more equitable healthcare.
Absolutely.
So here's something to think about. What if these tools weren't just for researchers or analysts, but fully integrated into the daily workflow? Imagine them guiding decisions in real time for doctors, nurses, social workers, everyone involved in a patient's care. Could we use this deeper understanding to proactively reduce risks, narrow those disparity gaps, and really optimize everyone's recovery journey? Definitely something to ponder.